inclusive physical, sport, fitness, and recreation. Next slide. Section 2 is an annotated bibliography of regulations, research, methods, tools, basically whatever's out there, addressing the following areas: policy, facilities, equipment, programming, staff and trainers, and users and consumers. Next slide. Section 3 covers what is required by the 2010 ADA standards for accessible design and gives best practices for facility layout and equipment scoping for different types of facilities. Now, there are also 3 additional sections under development. Next slide. Section 4 is about training and certification for staff. This is more than just for fitness trainers. Really, the heart of inclusive fitness culture is the staff. And if you meet all of the other requirements, you don't know how to interact with people of different abilities or how to implement the policies in your daily job, the fitness center, any fitness center, is going to fall short of meeting the needs of people with disabilities. And that means that all staff, not just trainers, require training in how to interact with and support people of all abilities. This section also provisionally includes information on what should be included in university curriculum. Next slide. Section 5 is titled Disclosure of Information, but it's really more for marketing. You've done the work. How do you let people know, and what do you let people know so they can evaluate whether your fitness center is going to meet their needs? Next slide. Section 6 is on policy topics, and this section really came out of drafting Section 4. We realized that there were specific best practice policies tied to what people should know and what hiring people with disabilities can bring to a fitness facility beyond meeting your non-discrimination laws. Next slide. So what are our next steps with the standards? And this has been a quick overview, but our next steps are to try to get sections 4 through 6 published. The closest is Section 4 on staff and trainer training, and we're in the midst of preparing that for the first round of review and comment balloting. It's an estimated 1 to 2 years to publication. This is a semi-optimistic evaluation of the amount of time each of these ballots is going to take. It depends on the work being done efficiently. Next slide, please. We also have a voluntary user survey we're getting together for Section 5 to make sure that what we say people need to know about a fitness center is actually what they need to know in order to get them to come in and see whether it meets their needs. And Section 6 is pretty early in the balloting and the drafting process. It's going to be another couple of years. Next slide. We can always use more experts, especially fitness equipment manufacturers and academic researchers. Next, you're going to see how one manufacturer worked with Shauna and the ASTM FO830 subcommittee to create a piece of equipment that meets the UDFE standards.
Hey everyone, my name is Ryan Eater. I'm the founder and CEO of Include Health. Just want to give you a little bit of an overview of the equipment that we designed, manufactured, and sold, put into the market specifically per the accessibility standards that were developed at RERCTech. This was the initial concept, actually like 15 years ago, of a piece of accessible fitness equipment before we were aware of all the ASTM standards and the initiatives going on. We got involved, we infused those, and the evolution of it became this machine here, the Access Strength. It was a functional trainer that was able to support standing seat and wheelchair use, of course, but also re-engineered and designed every element of interaction with the machine to remove the need for dexterity, to make sure that address the visually impaired, single arm adjustment, no left right arm bias, like all these details that were baked into the standards that took us quite a long time to develop. This is when we were infusing those and developing early prototypes that you see here and exploring different ways of doing it. We took it on tour, and we had a lot of different great feedback. We took it to Lakeshore, and we had worked with Shauna and Peter on consulting on this, and we got the device out in 2018. Hope that helps. I know this video is supposed to be short, and happy to answer any more questions you have.
Over to you, Dr. Basto.
Thank you, Sangi. My name is Beth, and you can go to the next slide, please. And what I'm going to talk about today is I'm going to talk about my involvement with the RECTech 4 project, starting with a link to previous ASTM work that Stephanie just outlined, and then talk about 3 ongoing projects, research projects, that are informing the current standards with RESNA IF, as well as identifying barriers to use of the ASTM standards, and then talk about future directions. Next slide. So I was brought into the ASTM standards discussion late in the process. Shauna and her group had done a lot of work with developing standards for individuals with physical disabilities and recognized that there was a need to amend the standards to include individuals with visual impairment. And because a lot of my work is in that area, I was brought into the project. And we had several publications based on our work. There were issues that came up when we were talking. For instance, one, you're seeing the symbol on the left, which is an able-bodied person running, an individual with a cane, an individual lifting weights in a wheelchair. That is going to be on the symbol that manufacturers use when they develop equipment that follows all of the ASTM standards. Now, that particular symbol did not exist before our talks. And so what we did is a research study to identify what would be the best symbol to identify accessible fitness equipment. Manufacturers didn't want the ISA standard, which is typically on parking placards, parking spots, accessible restrooms, because they thought it would be a deterrent from individuals who are able-bodied using that equipment when someone with a disability was not present in a facility, and thought that this may lead to gyms not purchasing the equipment. So I think it's just one of many examples that outlines how research informed the standards. Next slide. So with the completion of the standards, Stephanie stated some of them were done in 2015. And Ryan, you saw his short video of how people have applied the standards, but not many manufacturers had taken a big leap and applied all the standards. And so we wanted to find out why. Within that, we also wanted to find out why fitness facilities weren't accessible. The standards will go a long way to provide some guidance in that avenue. And then we also wanted to find out from consumers their barriers to using accessible or gyms. And so it is a 3-phase research project that we're conducting right now. The first phase is complete, and all 3 of these phases are qualitative research. So we're doing one-to-one interviews, very in-depth interviews, and theming out the data to determine the barriers to use. The first group was the manufacturers, and what we wanted to find out in the aim of this study is what were the barriers to using the ASTM standards and the UDFE standards to designing accessible fitness equipment. Next slide. What we found out, and we were able to interview 8 different manufacturers that represented all types of fitness equipment, gym equipment, outdoor equipment. And the first theme that emerged was challenges to developing fitness equipment. In terms of application of ASTM standards, they are really rigorous standards with test methods, and they felt that they were too in-depth to apply. Now, we saw Ryan's equipment, so we know it can be done. There was also a theme of humanitarian versus business. They all expressed a huge value in producing accessible fitness equipment, but they had a lack of a market analysis, as well as felt it was not financially viable to produce this fitness equipment. They also felt like there was a safety liability with producing it, that perhaps individuals who use the equipment would injure themselves or sue them if that injury occurred. And then they felt like fitness equipment facilities, gyms and such, had a lack of space and they wouldn't be able to accommodate the bigger equipment. Next slide. We also saw some ideas on how the scale could be tipped. So what could happen for these manufacturers to produce equipment with the ASTM standards? There was the idea of the carrot versus the stick. Some felt like, you know, if you were to incentivize gyms to carry this fitness equipment, then it would show a need to the manufacturers and they would start to produce it, versus a stick. Should there be law and legislation that holds gyms accountable for not carrying the equipment? They all felt like a market analysis was necessary to determine, you know, private as well as public facilities that might want to carry the equipment. They all stated they thought the ASTM standards were too rigorous and perhaps they should be modified. And they felt like influencers, individuals who are Paralympic athletes or other prominent individuals with disabilities could help with the marketing. Next slide. That brings us to the fitness facilities, which is phase 2. So we're in the process now of interviewing individuals who are decision makers at fitness facilities. And we want to learn the barriers and facilitators to accessible public and private fitness space, services, environments, and programming. Next slide. And so where are we at? We have interviewed so far 6 fitness facility personnel. We're hoping to interview at least 20. And we're interviewing them to learn their perceptions of universal space, what their programming, is it accessible? Is their equipment accessible? Is there space? And how they feel like we can move forward. For the ones, we definitely are interviewing facilities that are adapted. And so what are the lessons learned from those facilities? Just some really preliminary data with this. It's only 6 we've spoken to. They all have a fundamental value of inclusive design and programming. But the biggest barrier that each one of them has stated is there is a lack of funding. They don't have the money to implement programming, to train their staff, and to purchase accessible fitness equipment. Next slide. So phase 3 of the project is speaking to users. So we're speaking to individuals who use gyms who have a disability, individuals who don't use gyms that have a disability, and then we're speaking to individuals who have no disability that use gyms. What we want to learn is what are the trade-offs that individuals with disabilities would make to prioritize universal design, and then also gain the perception of people who don't have a disability in terms of accessible space. Next slide. And so where are we at with this project? We're looking at a fairly large sample size for qualitative research, and we're hoping to interview at least 3 individuals in each of the 3 groups. From the Southeast, Southwest, West, Midwest, and Northwest. And so we've made pretty good progress in some groups, but have you see if you're someone from the Northeast, we'd love to speak to you if you fit into one of those groups. Next slide. In terms of preliminary results, all groups believe in accessibility of space, equipment, and knowledge of a trainer, and that is individuals who use gyms versus don't, and those who have a disability versus those that don't. We asked the question to all of them if they would pay more money, since a barrier for the gyms is funding, to use a gym that was fully accessible, and every single person has said yes. Not every one of them believes they should have to pay that, but all of them said they would for tangible changes in a gym. A culture of acceptance is vitally important for those with a disability with a gym, and most of them feel like gyms lack this. And for those with a disability, thus far in our results, the ranking in order of importance has been number 1, that they felt like if trainers were knowledgeable and trained to work with a variety of disabilities, that would be the number 1 thing they'd like to see, followed by accessible equipment, and number 3, accessible space. Next slide. So what are our future directions with this project? When we're done with the 3 phases of the qualitative interviewing, we want to compare and contrast the results, see what's similar and see what's different. And based on that, we're going to develop a larger survey, hopefully to reach a larger audience to get their perceptions on accessible gym space. The results of that survey, as well as the qualitative data, will be used to develop a model of universal accessibility. We know what universal design is, but that changes and that's ongoing. And there really hasn't been a study that has looked at the perceptions of users of these spaces. After we're completed the model, we hope to develop and disseminate an ongoing survey. As our world changes, as technology improves, we know that there will be different trends in universal design. This isn't going to be a static area. And so based on the model and based on the trends, we'd like to develop an ongoing survey for all groups in this area. Next slide. Project team members of this group. Oh, went to the next slide. Beneficial design staff. These are individuals who have been integral to the project. Sangi, who you've heard from. Thank you to Jacob Davis and Outreach Grayson. Next slide. If you're interested in the projects I talked about, or even participating in them, if you're a fitness facility personnel individual that is a decision maker, or a trainer, or an individual that uses gyms, this is my contact information. I would love to speak to you. Thank you.
Thank you, Dr. Basto. Over to you, Allison.
Hi, good afternoon, everyone. So thanks so much for having me. I'm going to share with you a little bit about what we're doing in NCPAD related to connecting people with disabilities to accessible physical activity opportunities in the community and in home settings. So many of you are probably familiar with NCPAD, but we are the National Center on Health, Physical Activity, and Disability. We're a national resource and practice center focusing in health promotion, wellness, and disability. We're funded by the CDC, and we have been in operation for over 20 years under the direction of Dr. Rimmer. We just received another 5-year renewal to continue this work. So our work is focused on transforming people and places. We do health promotion resources. We do training and technical assistance. We do precision-based wellness programs, community and environmental changes, accelerating research to practice, which is kind of our role here with RECTech, and then focusing national attention on inclusion. Next slide. So this is a quote from CDC that I like to share. It really drives the work that we do in NCPAD related to community health inclusion. And it's that people with disabilities are best served by public health when they're included in mainstream public health activities. So we know that there's a lack of access to health promotion programs and preventative health services in the community setting. And this lack of access contributes to health inequities. And these inequities can affect healthcare, education, employment, and then overall health and wellness with people with disabilities. And so to address these gaps, what we do in NCPAD is we try to build capacity to serve people with disabilities through inclusive, accessible community programs, as well as looking at inclusive health promotion programs that can be done in a home setting. And our ultimate goal here is just providing an individual with access, opportunity, and choice. Next slide. So I want to share a few bits of data that we've gathered from the disability community over the past year. So in April of 2020, this was right when the world was shifting due to the COVID-19 pandemic, NCPAD and Lakeshore released a survey to explore what the needs of people with disabilities and chronic health conditions were related to response from the pandemic. So we released this survey online through Qualtrics and then also through Facebook, a survey for pages. It was over a 2-week period, and we gathered a national representation of over 1,400 people. And so of note is that 58% of the respondents reported that their health goals were not being met due to the pandemic, and that specifically the disability community asked for online content in areas of exercise, nutrition, and mindfulness. Okay, I think we're already, am I advancing the slides or someone else? I think we're already on the next slide. Go back to the previous slide, please.
Sorry.
That's okay. So more recently, this was another national survey that we did related to disability in the fitness industry. This is very similar to the work that we just learned from Beth, but it was related to the goal of learning how welcomed disabled people or people with disabilities feel in fitness spaces. So this survey was sent over a 1-month period, same platforms, Qualtrics and Facebook survey for pages. We gathered over 1,125 respondents, and the key statistics showed that 81% of people with disabilities do not feel welcomed in fitness spaces. And then more specifically, and this really aligns with what we just previously heard, which is very interesting, is that the community wants in a fitness space, the focus to be on staff training, usable equipment, accessible facilities, and then inclusive programming. And that almost half of the participants did report that they use a fitness gym, but that they also use outdoor parks and trails and virtual programs as opportunities for exercise. Next slide. So the results from this survey, we actually partnered with Degree Deodorant to launch a campaign related to this information. And it's calling on the fitness industry to be more inclusive and to hire disabled trainers. So the initiative is called Trainers for Hire, and it launched last month through an inclusive pop-up cycle event in New York City. There was a full-page ad that ran in the Sunday edition of the New York Times. And then NCPAD and Lakeshore collaborated with Degree to create an ally toolkit, which helps the fitness industry to operationalize what we mean by disability inclusion. So all these assets are available. They can be viewed and downloaded at the website, which is trainersforhire.com. Next slide. So I share those data points with you just to support the need that there is a need for disability inclusion in both home-based and community-based fitness spaces. And so what we do through NCPAD is we try to meet these needs. And we know that the community of people with disabilities want to know what opportunities are available to them. So NCPAD hosts and we manage a national directory and a technical assistance service. And we do this because we know that participating in physical activity can have a lasting impact on one's quality of life, and that the accessibility of a program or facility can really affect an individual's experience, their satisfaction, and their adherence. If they don't have a good first time visit, they're more likely not going to come back, and then they might not engage in regular physical activity. So one of the most frequently questions that we get asked through NCPAD is where to find an accessible community opportunity. And so to meet this need, we offer technical assistance on a wide variety of topics, physical activity, fitness, sports, general health promotion. We have a 1-800 number that operates Monday through Friday, 9 to 5. We have an email service and a live chat where someone can connect with an information specialist. We also have a national directory on the website that houses programs, organizations, parks, and personal trainers. It's all searchable by zip code. And the listings are offered for free. It's a national directory and it's crowdsourced. So organizations can create and manage their own listings. We do send a prompt about once a year to the organizations to be able to make any changes or updates to their directory listing. And through this technical assistance service and database, we see about 3,000 requests come in a year to utilize it or to ask an information specialist for more opportunities in their community. And the majority of those requests are people looking for an inclusive program or service near them. We do know that the current technology with this database is a little bit outdated and it's cumbersome for those users to update. So through working with RECTech, we look forward to the future of what this database will look like and growing our national network, making it more user-friendly with updated technology and better integration. Thank you.
Thank you so much, Allison. You all heard from Allison about the importance of directory, especially for people with disability, about accessible community, places where they can get work out. So in the previous cycle of RECTech, we developed an early prototype, which is a proof of concept. This was a geotagged crowdsourcing mapping system to identify accessible and usable community-based resources. Since it was a proof of concept, we used an off-the-shelf open source product. It was called Ushahidi, of course, which is now obsolete. During this period, like we trained students from the occupational therapy and physical therapy departments to go out in the community and assess the accessibility of places of interest, like fitness facilities, like places where they can be more physically active. So they mapped almost like around 400 facilities within 2 counties of Alabama. So just to give an example of how this works, so if you want to locate an accessible camping, on the right side of the screen, like all the type of resources are listed. So in that, like you click camping and then give your zip code, and then say within how many miles radius you're looking for an place which is accessible. And we also went a lot into depth about like the accessibility features. There were like minimal accessibility and also like advanced accessibility features. We went so much into depth that like we even like assessed the accessibility of restroom stalls and sinks and name anything. So when you give those details, like this is what the system was showing. So this was an accessible resource, Oak Mountain State Park, like in Alabama, in one of the counties that the students collected data for. So along with the camping, this also provides details about like what other options are available in that site. So for example, like the facility is Oak Mountain State Park. So they have like all these other options to be physically active, like golf, horseback riding, archery. And if you notice, like everything highlighted in green are like accessible activities. And it also gives details about the timing, the admission, cost, etc., and some photos as well. Just to give a gist of like what type of accessibility surveys like we did, just to get into the building, like these were like some of the questions used. And as you can see, it has details about measurements. So literally like the students were trained to go with measuring tape to measure each and everything, to understand like what accessibility is like, and they were like so detailed. And we also believe just because a place is accessible, it doesn't mean it is usable. So the example here, it shows the horseback riding. We also like collected details about all the adaptations provided by the facility on the each and every resource. So in the current cycle of RECTech, there were like a lot of things learned. Like number one, as I said, like the technology was obsolete, and it took us a lot of resources, like students to go into each and every facility and collect details in depth. So now in this cycle of RECTech, we are in the process of developing a proof of product, and we name it as RECTech Match. We use a person-centered approach, and to collect the details, like collect the needs, we interviewed 10 end users. All of them were people with disability, physical disability. And we also interviewed 5 health professionals, which included physical therapists, exercise trainers. And when we asked them about what is your perception about this system, what do you expect to see in such a system, like a mapping system? These were like some of the themes that came out. They want to know, apart from accessibility of the place, they also want to know what is their access to trainers. They want to have like knowledgeable staff in that facility. And due to the pandemic effect, like you heard from all the projects similar to, people were also interested in home-based exercising, and they also wanted like, can I have access to a coach who can help me on like what I can do in an own home environment? And they also want to find out place that will suit their budget, and of course, and reward system that will keep them motivated to be more physically active. Some of the main themes that came from the interviews were like, what do they expect as a feature in the mapping system? The main one is, what do they want to give as an input, like as for a search based? They want a search to be based on, okay, I use this type of assistive technology. Can I access this place with a wheelchair or with a cane? So that is something like they want to give as a search feature. Like, is that place accessible for me if I'm using this particular assistive device? And activities of interest. So everybody's interest varies, and they want to know, based on my interest, I want to find out like what is available within the zip code. And of course, for age group, some people like they were specific about like, I want to find something for my entire family or just for my kids who have disability, and also like based on the weather and seasonal accommodations. Of course, don't be jealous. In Alabama, like we have like good season throughout, and for people like from East Coast, everything is going to be day and night with the season. So that is again like one of the things they asked for. And the other thing was what the search results should include. And definitely how accessible that place is. And specifically, they were mainly interested about bathrooms, how accessible the entrance routes are, parking, how the activities are adapted. Do they have access to snack machine, or is there a water fountain? Like, these were like the most common themes that came out of the interviews. And of course, the age range, whether it's an indoor or outdoor place, and how much do I have to pay? And will that facility like also provide any insurance coverage? There are like various programs where like people with disability have coverage. So they want to know like silver sneakers. So they want to know whether like these are covered in that facility. And like I mentioned earlier, everyone were very particular about, do I have access to personal trainers or somebody who's knowledgeable about like how to work with people with disability, and timing of the facility, and also like what type of classes are offered by that facility. And another common theme was format preferences. There was a mix of people like the age range. The more tech savvy, they were like, we just need an app that's so easy and ready to go. But there were people who were like, no, I think like we need a website where we can download, print out the materials, and it's easy for me to log in from my laptop. So these were the just a gist of like everything we got from the interviews. Now I'll pass it on to Dr. Thirumalai to talk about the system in detail. Thank you.
Thank you, Sangi. So as you heard from Alison and Sangi, through NICPAD, we have had massive experience in building projects like this. We have been maintaining the NICPAD directory for about 20 years now, and we know what it takes to maintain a directory of this size at a national scale. So we have been doing, and you also saw some very recurring patterns across both projects. It's not just the accessibility which is important, it's the knowledgeable staff, knowledge trainers, and then the other financial constraints around going to a location. So we have taken a complete from scratch, go back to the drawing board approach. We are, splicing the project in every way possible to reach the most optimized solution. So one of those first things is there have been multiple data points you saw today where accessibility is important, but it doesn't mean people are looking out for 100% accessible places for every possible activity. People are willing to take compromises, and there is really a ranking we consistently see in much of the data we have seen across every project. Staff is the most important thing. And then is there really an adapted or inclusive activity offered? And then the egress, is the parking, entrance, and the pathways, are they clear enough for me to go and participate? And the last option is restrooms. So if you in the earlier proof of concept we did it so detailed, wherein we know for sure that that's not a scalable solution. If we want to scale it across the country and we want 10,000 locations to be listed and maintained, that's not scalable. So right now, our focus is on scalable solutions. So currently, we are working on a concept of accessibility, wherein we rank every location at 5 levels of accessibility. Level 1 is excellent accessibility, wherein they have knowledge staff and they have inclusive activities or adapted activities. There is the egress is accessible and restroom facilities are available. And so this is like the ideal place a person would like to go. But the ideal place is not going to be available across America in every rural location. So that is why we are working on categorizing at 5 levels. I'm not going to read over everything, but the first one was excellent accessibility. Second is good accessibility. Third is moderate accessibility. Fourth is minimal, and 5 is not accessible. Even though this sounds very wordy when I put it here, this all ties up to just about 10 to 15 small one-line questions. By connecting it to just simple about 10 questions, we are able to categorize the accessibility level of every place out there. Why is this so important? Just take any famous crowdsourced project like Yelp. Yelp just follows ADA accessibility. It's self-answered. It's a single question. The restaurant just comes and says, I am accessible. I know so many restaurants out here in Birmingham where we go, they claim it's accessible. There is a single table, and that single table is on a raised platform, and you need a magician along with you to really be able to access it. So we are not looking at that level of accessibility. And there are many large-scale projects happening. There is a project by Google, I forgot its name, sorry, but there is one more international project, wheelmap.org. It's a very useful project. So we are closely monitoring all those projects, but at the same time, we have a massive database. We already have over 5,000 records. How can we maintain it with the balanced level of information is what we are experimenting with. I'm going to quickly show you some of our prototype screens we are, experimenting with. This is our, the geolocation screen, wherein users will be able to filter by activity type, accessibility level, and distance. We heard an overwhelming theme. Yes, we need community-based physical activity, but not every day is the same. As a person with disability, one day I could be experiencing pain, one day I'm fatigued, and so on that day I need an alternative. And so we are including home-based activities at a minimal level. And then if you heard the constant discussion point, knowledge trainers or a coach. We cannot make available a knowledge coach in every location across America. That's not what we are capable of. But we can provide training. Of course, our national center provides certification. It's called the Inclusive Fitness Certification and so on. But through RERCTech in our pilot project, we are enabling a coach to work along with the participants to help them identify the most appropriate facility that would work out for them, and also talk to the participant on how they can adapt the activity which is available at a given facility. So here you are seeing some of the dashboard screens. The coaches are able to keep tab of who to call. They are able to set goals for the participant. A goal here is, I want to push 5 miles outdoors per week. And then the coach is able to, the system keeps tabs of all the notes. The coach is able to see the Fitbit steps that have been collected. That way the coach knows whether the participant has been active or not. Again, I didn't include too many screenshots here. The coach will know how much of home-based exercising the participant is doing versus outdoor activities based on our check-in feature and how much home-based video the person is watching. Our ultimate aim here is to promote community-based exercise, but sometimes you need to first get people engaged in home-based exercise before you can really enable them to go out into the community. And this is where the health coach plays a very critical role. As you heard from Allison, we provide technical assistance. We have a hotline number, and we field around 3,000 calls. Our goal is this RERCTech match system by fusing home-based exercise, community-based geolocation, and crowdsourcing with the health coach concept to monitor what people are able to do and not able to do. We can really push the needle forward. So currently, we are experimenting different types of digital awards, really automatic rewards. It's much like your Starbucks rewards program. The more you go outdoor and become active, instantly you get digital rewards assigned to you. And so we are experimenting on such concepts. And here is a quick snapshot of the protocol for a small pilot study we are doing using this project. I should recall that this is a development project. And so this is a really small study we are running. So all participants will be provided with a Fitbit. The study intervention period is going to be about 12 weeks. The control group will receive just access to NICPAD website. NICPAD is the single largest usual care available for people with disabilities. And people who belong to the intervention groups, weekly, there'll be a coaching call from our postdoc, Christian. Christian wears many hats. He prototypes active video gaming controllers. One side he's a health coach, one side is an exercise coach, and so on. So our purpose here is to provide a little motivation, help people identify locations of interest around them, and get them activated in the community. Again, I know I'm speeding, but if you have any questions, please stop me. Again, no project here is possible without contribution from so many people. Again, this project has consumed so much people, and thank you to all the team members.